Hi, I'm Dr. Bruce Evans, orthopedic surgeon at St. Mark's Hospital. I'm going to describe to you the reverse total shoulder arthroplasty. The reverse shoulder replacement is designed for patients that have arthritis but do not have a rotator cuff. So the problem with those patients is that their shoulder is sitting up too high and they don't have a rotator cuff to keep the shoulder down. And so that's why the reverse was designed for people that do not have a rotator cuff but have arthritis. So it brings the shoulder back down lower and allows them to lift their arm all the way up again lift their hand above shoulder level. So those are the type of patients we look for that really benefit from the reverse shoulder. Those that have arthritis and don't have a functioning rotator cuff. On a reverse shoulder replacement, we actually put the ball on the cup side of the shoulder, and we put the cup on the ball side of the shoulder. So essentially we are reversing the normal type of implants you would expect. And the way to show that is to show a traditional shoulder replacement has the ball replaced on this side, and on the other side it has a cup replaced. So this is your traditional total shoulder where you have a ball and a cup. But on a reverse, you do just the opposite. You actually put a ball on the cup side and a cup on the ball side. So you are reversing the implant, and it looks like this. Well, the advantage of a reverse shoulder is you're not waiting for muscle repair, and so you can move the shoulder immediately. And the advantages of these patients is that they get to use the shoulder right away. They don't have to be in a sling for any length of time. And that makes it recovery very quick and very fast. So it's a very, very advantageous type of surgery because of the quick recovery.